Our delegates, Dilshad sir, currently available in sir 249 doctors available in
Very good.
Ara, Buxar and Chhapra. Are most welcome sir, all delegates. Today a special webinar, novel 3-dose anti-rabies service. Or our speaker guest, Dr. Dilshad, a renowned doctor of Buxar. Most welcome, sir. Dilshad, sir.
Yeah. Thank you.
Uh, please start the sir
Uh,
slide, sir.
First of all, I am very sorry for the delay, and I welcome all the delegates, respected doctors of all the places who are being here and sharing important time with us. Thank you once again. Today, the small precise Zoom meeting, that is on novel 3-dose G protein vaccine. That is ultimate key for compliance. We are starting, and hopefully it will be good. Yeah. It is a merely public health challenge in India. Globally, around 59,000 human deaths annually. That is recorded highest in India. India had 20,000 human deaths a year from rabies, accounting for 60% of the rabies deaths in Asia, and 35 globally. 91% deaths in India occurred in rural areas. Current management, we are concluding local owned treatment, that is first aids, active immunization by vaccination, and passive also by RIG. And rabies post prophylaxis, we all know about that, 5 doses, that is intramuscular regime, that is old one. Non-compliance, there is current rabies vaccine as well, are cell culture vaccines. There are also inactivated vaccines, more than 50 years old technology, that is. But inconsistency in potency, stability, availability, short supply, there is also a short supply, and there are various adverse events. In compliant, we see from anti-rabies vaccine, that is, who received the full course of ARV, that is the scheduled doses of ARV on the recommended dose dates. Delayed compliant is who completed the scheduled dose of ARV within 60 days but deviated from the scheduled regimen. That is 5 that we all know. Dropout and non-compliant is who had taken at least 1 dose of ARV after animal bite but not completed all the scheduled doses. Non-compliance to 5 doses, that is proven cause of death. Number 1 case was 58 years female, street dog that killed soon. 3 doses purified chikungunya cell vaccination, rabies 037, no rabies immunoglobulins. Chronology of events was, clinical features was dog bite category 3 at the right side of the nose, 20 days, paresthesia of face 20 days after developed, fever and restlessness after 5 days developed, ahead that was altered sensorium, that was from 1 day. CSF finding was total cells 5, that was monophosphorus 100%, protein 126. Sugar was 71. Diagnosis considered was rabies encephalitis. But the confirmatory test that shows rising serum and CSF virus neutralizing antibody titer of 18,192 and 12,048 respectively after 5 days of previous sample not done to the llama. MRI finding was also bilateral brain state mild hydrocephalus, hyperintensity without any restricted diffusion. Treatment was modified, that was protocol from day one. Hospital survival of 16 days only. Second was 38 years male, that was a stroke street dog, and this doses vaccine was only also of 0, 3 and 7. That is also non-compliance, dog bite category 3, and dysphagia restlessness. CSF finding, that is not done due to llama because patient was taken to the other hospitals, and diagnosis was made of rabies and encephalitis. Confirmatory diagnosis, it was also a cause of llama, which was not done, and MRI finding was also not done because of llama. In treatment, they gave support.
स्क्रीन थोड़ा आपका आगे नहीं बढ़ रहा है सर.
नहीं तो ये स्क्रीन सेम है.
अच्छा.
हाँ.
yeah.
Same screen, there are 3 cases which
Yes,
I
sir.
am describing it.
ठीक.
And all this one is last hospital due to llama, they didn't took treatment, and that was also non-compliance to 5 dose, and that was cause of death. Last but not the least, street dog, 3 doses vaccine, he also taken 037, same category of chronology of events. CSF finding was also same. Confirmatory test, babies RNA PCB positive, and MRI was not done. Same treatment that was modified, Milwand key protocol from driver. The reason of deaths may be due to lack of administration of rabies, as we all discussed. Original article compliance to post-exposure prophylaxis among animal bite patients, a hospital-based epidemiology study. At Safdarjung, New Delhi, 360 animal bite patients. A pre-designed, pre-tested structure question was remitted by the interview technique. That was 53% were non-compliant to full course of ARV. So we are going to the slide compliance to anti-rabies vaccination in post-exposure prophylaxis. At Municipal Corporation Hospital, Bangalore, 215 animal bite patients. 1 dose of rabies vaccine administered intramuscularly on days 0, 3, 7, 14 and 28 SPEP also measures constraints for compliance to complete course. And day 28 compliance was only 60%. So concentrates for compliance to complete course of anti-rabies vaccine. Interface with the school timing was 11%. Distance of hospital was also 11%. Cost incurred 13%. Forgotten dates 18%. So there are many categories which are a leading cause of death in ARV. Evolution of rabies vaccine took place, and that was live attenuated vaccine, second inactivated vaccine, 1885. Cell culture inactivated vaccine, cell 2.5 international unit. लगा दो बस. Meeting the medical need, introducing a novel vaccine with simple and shortened regime. Novel 3-dose recombinant rabies G protein vaccine, that was new one which we are talking about. First vaccine with 3 doses. This is the first vaccine with 3 doses that was given intramuscular regimen, that is 0, 3 and 7 days. Prepared by VLP platform technology, first protein subunit vaccine, and it is better compliance due to easy to flow regime and less visits. Convenience is that ready to use, no reconstitution needed. This is VLP technology. By this one is this vaccination that is of 3 doses was ready, and this is nice historical diagram you can show. We can see it. and native virus that G protein, its pathological symbol has made. G protein is difficult to stabilize. Then G protein isolation, this is using VLP technology purified and stabilized by Cadila Pharmaceutical Limited. Virus-like particles are protein complex exist nanoparticles. VLP are similar to native virus particles but that do not contain the viral genome. They cannot replicate but can mimic the viral antigenicity without being pathogenic. They are capable of inducing a strong humoral and cellular immune response. This is VLPs as vaccine. This is newer technology by which Cadila is formulating the new vaccine. Clinical study phase 3, we see safety and immunogenicity of novel 3-dose recombinant non-particle rabies G protein vaccine administered as stimulated post-exposure immunization. A randomized control multicenter phase 3 clinical study was done to evaluate immunogenicity and safety of rabies G protein vaccine administered as stimulated post-exposure immunization in healthy volunteers. That is 0, 3, and 7 regime. Compared to that of 5 doses, it is best one. Randomized comparative controller multicentric study, and that was 533 subjects. And comparing to that one, 5 regimen to 67 subjects. Total subject was 800 and randomization was 2:1. The result we can see we are consistent across different age group and genders. Observed difference 1.52%, 95% of compared to 0.18% to 4.17% with pre-specified margin of 4%. Non-inferiority for seroprotection primary endpoint day 14 and 42 were met. Test and comparator are identical in seroprotein rate both on days and 42 and 43. And safety point of view, we can see it is significantly much better than 5, that is ARV. Novel 3, so we conclude the study. Novel 3 dose was non-inferior to reference vaccine, less adverse effect compared to reference vaccine. Novel 3 dose was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. So the last but not the least one, that was Global Golden Globe Tigers Award given in Malaysia for Innovative Product of the Year for Cadila, and that is Pharma Innovation of the Year by the Economic Times. Many congratulations. So this was the conclusion.
Thanks, sir. Your valuable shop timing, sir.
Yeah.
One question from Chhapra.
Okay.
Dr. Singh, S.K. Singh.
Okay.
Chhapra. Question is as per your opinion, who is the best 3-dose or 5-dose ARV?
As per my opinion, Dr. Saab, I think this one ARV3 that is formulated by Cadila one is nice one because I am using since 1 year and it is better working because of less duration also because it has only 3 doses. I think it is the best one.
Sir, and another question from Ara.
Okay.
Another question in Ara में एक मिनट क्वेश्चन थोड़ा सा दिख नहीं रहा है मैं What is the symptoms of rabies?
Oh, that symptom may be hypotension, maybe phobia to the water. Patient may sink down and we feel that what happened to the patient, but at last the diagnosis would be rabies because there will be hydrophobia that we all know, And first there will be loss of consciousness, mild loss of consciousness, and maybe altered sensorium with high blood temperature.
ये खत्म हो गया.
Thank you, sir. Thank you. Another question from Ara. Again, Ara.
Okay.
How does one treat an animal bite?
Animal bite.
Hmm.
Just we will do a normal dressing. We can give prophylaxis first, TT and antibiotic, some painkillers with PPI drugs. But we can suggest for ARV that which was formulated by Cadila by VLP technology. That is best one.
Thank you. Thank you very much, sir. Abhi, sir, total participant available in the
Okay.
webinar,
Okay.
469. 469 total participant.
It is
Thanks
good
for,
number.
Ara, Buxar and Chhapra.
Chhapra.
So thank you very much, sir. Each and every participant and delegates, and especially, sir, thanks for valuable timing, Dr.
No,
Dilshad.
it's all right. We are always available for this kind of formulation. Thank you, Sanjeev.
Thank you very much, sir.
Thank you all, Sanjeev and all team. Thank you very
Thank
much.
you very much, sir.
Okay, okay.
आप लॉग आउट हो जाइए सर.
हाँ, लॉग आउट हो जाते हैं. बढ़िया रहा ना. कैसे लॉग आउट हो गए? यही है ना. कट कर दिया. स्टॉप हो जाएगा. यस.
पारुल मैडम.